Good morning and welcome to the Pittsburgh Regional Health Initiatives Patient Safety Research and Development Salon. My name is Robert Ferguson. I'm the Chief of Policy Officer at the Jewish Healthcare Foundation and help to manage the Regional Autonomous Patient Safety Initiative. And that initiative has a vision of establishing Pittsburgh as a global tech hub to develop autonomous solutions to the increase in injury and harm in healthcare settings. And to help achieve that vision, these research and development salon sessions are designed to help stimulate a pipeline of patient safety research and discovery and adoption activity in the Pittsburgh region to create and scale solutions for patient safety. And as such, these sessions are designed to learn about those patient safety priorities, including the needs of providers, patients, and other healthcare stakeholders. Throughout these salons, we also explored the applications of technology to patient safety issues. So the first salon talked about the use of a digital twin technology to help patients and the providers make the best decisions about diagnoses and treatment plans. And they are also designed to help understand all of the strengths and assets in the Pittsburgh region, meaning all of the work that of the participants on this salon. And I'd like to encourage everyone, if you haven't already, to take a look at the RSVP and a participant list, because that list also talks about some of the patient safety interests and work that all of you are doing. And to further help with that, I would also like to ask everyone on today's salon to use the chat to type in your name, role in the organization you are from, and also just to talk a bit about the work that you are doing that can be applied to improving patient safety in healthcare settings. And we also use these salons to help make connections across all of the participants and to identify opportunities for you all to jointly apply for grant opportunities to bring additional funding for research and development to the Pittsburgh region to help create and implement solutions to injury and harm. And to further support that early stage research and development work, the Jewish Healthcare Foundation with the Pittsburgh Regional Health Initiative have also made available up to a total of $300,000 through seed grants. These seed grant applications are due by October 16th. There's three categories of seed grant awards that people and organizations can apply for. And the first category is $25,000 in the seed grants for startups and innovators who are developing ideas for tech-enabled patient safety solutions. The second category includes $50,000 seed grants for healthcare organizations that want to help pilot test a technology-enabled solution that's been developed by a tech group or a research team in the Pittsburgh region. And then the third category is also a $50,000 seed grant for research and development teams that are in the early stages of developing ideas for a patient safety tech research. And we also just want to take a quick second to also note that we're excited about the upcoming salons on October 11th and December 6th. If you haven't already, please visit the Pittsburgh Regional Health Initiatives RAPS page to register for these sessions in advance and also to access materials from the past sessions. And on that site, the recording of presentations will be posted for this particular salon as well. And we are very excited to have a phenomenal group of research leaders in the region speak about the federal funding opportunities that are advancing safety science research and development in the region. And I am particularly pleased to introduce the first speaker, who is Dr. Theresa Mayer. As the Vice President for Research at CMU, Dr. Mayer provides executive oversight and strategic guidance to CMU's global research, creative, and entrepreneurial efforts. Before joining CMU's senior administration team in February, Theresa was Executive Vice President for Research and Partnerships at Purdue University. She has extensive experience fostering public-private partnerships, which is really what RAPS is also about. And she's also widely recognized for her own research in advanced manufacturing of nanoscale, electronic, optical, and biomedical devices. And several of the co-inventions of hers have been transitioned to commercial products as well. And when we were researching all of the Pittsburgh region's assets to become a global tech hub for developing autonomous patient safety solutions, we were struck by CMU's increase in NIH funding. And we are excited that Theresa's here to speak about CMU's NIH funding and the intersections with patient safety research and development. Dr. Mayer, I will turn it over to you.
Yeah, thank you so much for both the invitation to participate and your very kind introduction. It's a real pleasure to spend this time with everyone and really get to know the Pittsburgh community better. As Robert said, I joined Carnegie Mellon in February, and it's been a very exciting 6 months, not only really doing deep dives within Carnegie Mellon, but within the region. For point of reference, I did spend 23 years at Penn State. So I have been part of the state of Pennsylvania for quite a while. I'm going to try to share my screen and let's see. Give me just a moment here. And hopefully, are you seeing the PowerPoint?
Yeah, once you expand to the presentation mode.
Yes, I'm trying to get that. Here we go. Alrighty. So I am going to pivot just a little bit from just focusing on NIH funding to just try to provide really a broad perspective of the work, not only that we're doing at Carnegie Mellon, but really in partnership. As we'll talk about, we have deep and growing partnerships with the University of Pittsburgh, as well as medical centers and other academic and industry collaborators. But before I do that, I thought I could begin by kind of framing the Carnegie Mellon research and innovation ecosystem more broadly, and the role that we have played in really enabling the renaissance of Pittsburgh together again with partners throughout the region. I think coming to Carnegie Mellon, one of the parts that was very attractive is really the robust and diverse ecosystem of research capabilities, and really the ecosystem. This slide shows not only do we have the main academic enterprise that tends to focus more on what we would call foundational research and early stage use-inspired research, where we're driven by the vision and aim of what we're trying to accomplish in terms of a particular grand challenge. But we have a robust ecosystem that supports the translational activities. And what you will see here is the ongoing effort that we are building out in the Hazelwood Green area area. This is our Manufacturing Futures Institute, soon to also include the Robotics Innovation Center, which will be side by side with the new Bioforge that the University of Pittsburgh is building out. And so this is going to, again, bring a very vibrant ecosystem to some of the things that Robert introduced, as well as the National Robotics Engineering Center, which has truly been at the center of the explosion of robotics and automation companies that have made Pittsburgh their home. And finally, the Software Engineering Institute, which is one of only 2 federally funded research and development centers in the country. And that is focused, as the name implied, on software engineering, but also cybersecurity and AI engineering. And all of those play a role in the topic that we're discussing. Robert pointed out our fairly substantial growth in funding from NIH. Just over the last few years, we've grown, although again, paltry in comparison to University of Pittsburgh, with the very large medical school, but nonetheless playing a very important and I think growing role in the ecosystem that is looking at health science and technology. Just over the last few years, we've grown from right around 20 million to over 44 million. And looking at the pipeline for next year, we're expecting some very substantial awards, really focused in the areas that the Salon is focused on. In addition to that, I'd also like to point out DoD is our largest funder, together with the National Science Foundation, and NIH is not the only support that we receive for the work in biomedical and health science and technology research. A very significant and growing fraction of work from other federal agencies, as well as our industry and nonprofit partners, is playing a really critical role in bringing some of these foundational technologies to bear on topics such as patient safety. This slide, I think, tells an incredible story and one that we can leverage as we think about the continued building on the base of innovation in autonomy robotics, as well as bringing in leading companies in the high-tech sector that have come to Pittsburgh, in part because, and many of them have acquired startup companies that have come out of our universities, or they're attracted here because of the talent base. So again, this builds a very, very strong foundation for continued advancement and investments that are being targeted by the foundation. So it's a really exciting time to be in Pittsburgh. This is highlighted also in our national strategy, looking at place-based and industrial strategy. This is the first time in probably over 50 years where the U.S. is recognizing that the changes in the economic climate and really the focus on digital technologies and high tech and driving the cities and areas where, again, we've seen in many cases population decline. Really the takeaway here is from a recent Bloomberg study showing that Pittsburgh, highlighted in the blue dot, is bucking the trend in seeing an increased growth in high-tech sector, in the innovation sector. So again, it places us in a great position to be a national leader and to build on those core strengths. So with that as context, I'm just going to provide a high-level overview of some of the initiatives, just to give the people who are listening a taste of the richness of the research that is ongoing at Carnegie Mellon that is directly relevant. And the first that I'll begin by highlighting is a new National Science Foundation funded AI Institute. These are very competitive and prestigious awards. Carnegie Mellon is part of 5 of these AI institutes. This one is being led by Carnegie Mellon and has partners both in the region and outside of the region, and it is on societal decision making And I think the topics really show how the foundational work can span multiple areas. The areas of focus here include disaster management and mitigation, as well as health safety. And in the area of health, the particular focus is on maternal and infant health. And so again, it really cuts at the center of what we're talking about at the Salon. The NSF AI Institute was just launched, and so we're looking for very significant advancements. As a major national institute, it also really plants a flag in the ground for Carnegie Mellon and Pittsburgh being a leader in this area. So we're really looking forward to seeing how this will benefit not only the nation, but our regional ecosystem. And we're very happy to engage with others to talk more about the AI Institute that's being led by Professor R.D. Singh, who's in our machine learning department. I also thought I would do a slightly deeper dive on some NIH funding that we've received that's very much focused on the concept of clinical decision support. And this is looking at a ventricular artery device implant. And here, being led by John Zimmerman, the work is really aimed at understanding how we can deploy AI tools in decision support, but it's really looking at the human interaction as well, because that's very critical, not only thinking about the fact that AI and other computational approaches can enable decision support, but really thinking about the adoption and some of the lessons learned in terms of the AI tech innovators' assumptions turned out not to be true. And so going in thinking that clinicians will both want help and know that they need help in these areas, and that the adoption of the IT systems will, if we build it, they will come. And in fact, that turned out not to be the case. And so part of the work is really taking the innovations in technology and AI and bridging the gap and meeting clinicians where they are at this moment in time. So this was termed unremarkable AI, and really looking at how to integrate on dashboards that clinicians are using in more of an incremental fashion to build that trust and respect. And so, again, not only thinking about the technologies, but also our community here gives us the I think, somewhat unique potential to really drive that in a very large clinical setting and move forward in the area of human factors. I'll just highlight a couple of other initiatives, just again, to give you a sense of the richness, and I'm really only touching on a few. The Delphi group has been in existence for quite some time. Most recently, it has become a CDC designated center of excellence for epidemic forecasting and became really nationally recognized for the launch of the COVIDcast project. And so here, one of our next speakers is going to be talking again more about the topics of public health. So really, again, sitting at this intersection of computational sciences, machine learning, AI, but bringing real-world data from the robust data sets within our region and leveraging the core strengths at Carnegie Mellon and beyond in order to drive to really very impactful solutions. So once again, we are nationally recognized for our leading work in epidemic forecasting. I'd like to highlight that Carnegie Mellon is making a very significant investment in a topic that is really becoming the center of a national dialogue in the future of science around automated science. And so this is, again, where we bring together the tremendous advancements in automated instruments, automation and automated instruments together in a closed loop and integrated cycle with machine learning and AI in order to really advance the future of science and the concept of self-driving labs. And no, that doesn't mean that we're going to put labs in cars, but instead, again, that we can use rich data sets that are created in a way where we completely control instruments through computer code, and we collect robust data sets and metadata sets that fully describe those experiments and be able to make those open to the general public in a way that they can be integrated into the future design, with an ultimate vision of maybe AI being able to think about what those important next experiments are. And this has incredible significance to everything from biopharmaceuticals to energy research to material science research. And again, this is an area where Carnegie Mellon and Pittsburgh will have the first academic cloud lab, is what it's called, but importantly at scale, hosting over 200 instruments and being able to drive experiments 24/7. So bringing together in a closed loop cycle experiment and computation, which is certainly, again, relevant to the topic at hand. And finally, I'm just going to end with one other integrated center that's received significant support from our community here in Pittsburgh, which is the Center for Innovation and Health. And you can see that this is touching so many different topical areas, all with the foundation of how do we advance digital health research and technology through the development of AI and computational solutions, really focusing on collaborative partnership and the transfer of knowledge and methods. And so with that, I hope that in a very short amount of time, again, just provides a high-level overview of some of the more significant initiatives within Carnegie Mellon. And I think, again, really thinking to the excitement of the future as health is becoming one of the more substantial priorities within Carnegie Mellon at this moment in time. So thank you.
Yeah, thank you very much, Dr. Mayer. That was a great overview. And we have a few minutes for any questions from the participants, or if anyone would like to talk about their related work in this area. Dr. Pisich, your hand's up.
Yeah, really phenomenal overview, Theresa. I really enjoyed it. I'm actually in awe of the funding diversification that you guys have. It's obviously very complementary to Pitt and the health sciences, which has a predominantly NIH-based portfolio. The good news is leadership in the health sciences is really pushing us to do more with DoD and NSF, where you guys have strengths. So there's really opportunities for major bridge building. As a person that's been in this ecosystem for a long time and participates in all three phases, the research and development and NIH funding, clinical practice with the UPMC, our partner, and also in the entrepreneurial ecosystem with startup companies that we've pushed forward in this environment. I'm still looking for the secret sauce to figure out the better way to bridge our two, phenomenal universities. So what are your insights? What do you think we can do better to make it more liquid for our teams to work together, to participate in joint efforts, and to take what is a good start to full fruition with very, very strong and lasting bridges built?
Yeah, thank you so much. And it's such a great question, and one that as I've moved to Pittsburgh and become more immersed in the Pittsburgh ecosystem, have started to give a very significant thought, and I know many of the leaders have been coming together to have this conversation. In fact, Kinsey's going to talk about the Tech Hub initiative. I think looking at the secret sauce of Pittsburgh, again, this renaissance of Pittsburgh that has occurred over the last 15 to 20 years, which again, the nation is looking at us as the success story. One of the things that we've learned, and there was a recent Forbes article that highlighted the importance of the universities driving translation, but also the importance of the federal government, the state government, and the local and regional government. And that has been the secret sauce. I mean, we've worked together incredibly well, starting to bring in more venture funding. I think, if we look at the autonomy and robotics, and that was one of the reasons that I highlighted NREC, one of the areas that was so critically important, I think, that has made the difference is that building out the capability to work in, that really far more applied and translational area, and receiving external support to do that, to lower the barrier to transition, has been very key to the success. And once the ecosystem starts to move, along with very favorable tech transfer policies, and that's an area that Carnegie Mellon has invested in, very favorable tech transfer, particularly for startups coming out of the university. So looking at those success stories, it does feel that the time is right. Looking at the future of the health area, where that technology foundation can be so critical. We can build on the strengths that our region has, and those are the conversations again that we're having between Pitt and Carnegie Mellon. So the Tech Hub, this is a Department of Commerce initiative. If we're fortunate enough to move forward, that would provide a very instrumental movement for the region in this area. But even if it doesn't, I think, continuing to build those bridges, but really with an outcome focus. But I will underscore what I am hearing is that we collectively really need to come together and focus on some of our tech transfer, policies and intellectual property policies, because we don't want to get hung up in those areas. So I'd love to have a much deeper conversation on that great topic.
No, thank you so much for your response.
And Alan, and then we'll switch to the next presentation.
Unmute myself, and then point out that we are working with the Institution for Patient Safety Research with Carl and Heather and Ari, who's not on the call, and also with people from Pitt, getting the MERS data with funding from the JHF, so thank you, to try to use sort of AI methodology to discover patient safety causes, specifically medication errors, with the hope of then operationally being able to detect them and alleviate them, prevent them before they start. And so I think one thing we have to be able to do is sort of have a multi-pronged effort. We have student projects going, or going to go next semester, which is like now, working on institutional research. And also I think we need to look for regional partnerships. It's hard to partner with national pharmacies, for example, if we want to look at pharmaceutical safety, but we might have an easier time getting in with someplace like Giant Eagle, who we have a closer relationship with, and the county government, because I think we really need to work at a proof of concept on a small scale where we actually have leverage, and then we can kind of get better leverage regionally or nationally. I think there's a lot of things going on. It's just a question of figuring out what's going to hit and then pushing them and establishing a greater reputation.
Yeah, I'm just going to pick up on that, really excellent point, and kind of come back also to the last question. we oftentimes talk about research and development, particularly in the context of the university. The important point that's being raised is that we need to focus on research, development, and deployment, because that deployment is such a critical part. So it's, either with, the clinicians or with the industry partners and others. So yeah, +1, just want to echo everything that you just shared. And if we can identify resources and, groups that are willing to basically take a risk, because these cultural shifts are very, very, as we've learned, they're difficult. And so these technology insertions are definitely going to mean that we need to approach it from across the spectrum. So again, thank you to everybody.
Yeah, thank you very much, Dr. Mayer, for joining us, and again, excellent overview. Thank you. And as a segue into the next presentation, I'm also very pleased and excited to introduce Dr. Michael Holland, who is the Vice Chancellor for Science Policy and Research Strategies at the University of Pittsburgh. And in that role, he develops strategies to support cross-disciplinary research. He also coordinates the university's response to research policy opportunities. And on that note, we are especially excited he is joining us this morning to talk about the opportunities to modernize public health approaches with big data analytics and technologies by leveraging the region's assets. Dr. Holland, I'm pleased to hand it over to you.
Okay, great. Thank you very much. Let me share my screen. Let's see. Hopefully you will. Do you see the, is it in presentation mode? Great. Okay, thanks. So just a little bit about me. So I report to Rob Rutenbar, the Senior Vice Chancellor for Research. In a prior life, I helped set up a new center at NYU focused on urban informatics. We had a lot of interactions with the city agencies of the city of New York, and had a wide variety of projects. Some of those focused on quality of life, some like noise abatement that actually affect educational outcomes and are sort of environmental stressors. I was in DC for 13 years as a oversight staffer for the Department of Energy's Office of Science. So I had a lot of experience with high performance computing, climate modeling, other community codes, kind of thing. So that is me. So precision public health. I think the thing that we have an enormous amount of opportunity in this space. It is a sort of a relatively new area of work, and it's this sort of, there's that notion of precision medicine, so delivering the right intervention for the right patient at the right time. But precision public health, it's trying to deliver that right intervention to the right population at the right time. So I think there are some areas where the traditional notions of public health, right risk factor and disease surveillance, right screening, interventions, designing the interventions, sort of assurance that they're working, and then sort of evaluation. There's opportunity across that entire spectrum, and our trick is then to figure out how to find the right thing for Pitt and CMU to work on, where there are enormous opportunities that bring together our assets, and then find that right niche. So, in those public health imperatives, right, that we want to make sure that everyone can benefit from the improved precision medicine, and start figuring out exactly how to slot those in so that they are both affecting patient delivery and healthcare delivery, that they're impacting public health policies, and driving those improved implementation strategies that are supported by that population data. of course, one of the challenges is making sure that those improvements in precision medicine are actually benefiting health outcomes for everyone. And so we have to marry up that sort of health equity agenda along with the precision public health and precision medicine piece. There are areas where there are population-specific needs and outcome assessments, and we want to make sure that we can use precision public health to both identify those, help develop interventions, and make sure that we have assessment tools that are appropriate for ensuring that we're having the desired outcomes. So this sort of approach to things, I think, when you look at some of the early articles on precision public health, there was very much a sort of, bringing omics to bear on the sort of the risk factor and disease surveillance pieces. I think, the challenge moving forward is how to both continue to develop that area as well as broaden this out so that we're seeing how we can improve that precision at all of those stages of the public health chain. I think I went in the wrong direction. There we go. Okay. And so, again, population-specific data is going to be, a key for informing how to, apply the right intervention at the right time for the population for a wide variety of populations. We need to sort of bring in, and broaden the conversation beyond just sort of the technical communities of, whether it's medicine, public health, data science. There are, I think, opportunities for figuring out how do we better understand how to craft interventions, drive them into policy, develop the implementations on a rapid scale, and have multiple of those operating in tandem. And so I think the focus of many people in this area, on this call in the salon, on patient safety, like that mindset of really figuring out, with care throughout every step of the healthcare delivery chain, where there are opportunities for error, where there are opportunities for improvement. I think we want to actually sort of take that mindset and, again, look at every step of that chain in the public health process. And that is more than just a technical issue. So why Pitt? So we have a very strong presence in public health, and our dean, Maureen Litchfeld, is very interested in this issue of precision public health. We are coupled to that, we're one of the leading academic health sciences universities in the country, currently #3 in NIH funding. We also, when we look at the ecosystem of our peers of that NIH funding, not everybody has a school of public health. Not everyone has a large school of public health. And so that is an asset that we have here, and we want to figure out how to use that. We also, not all of our peer universities at the high end in NIH funding have those broad professional health science schools. So we do in fact have a larger network of health sciences schools, so dentistry, medicine, pharmacy, health and rehabilitation sciences. So there's a wide variety of skill sets that we have to actually address public health issues, both in the clinic and in the community. And so I think that positions us very well. And then, well, I can just go over that. why Pittsburgh, right? Our assets here at Pitt. You just heard Theresa talk about, many of the incredible resources on the engineering and computer science and data science front, robotics aspects that CMU brings to the table. So I think our challenge is figuring out then again how to bring this sort of remarkable resource base together and to aim us in a direction where we can make important and distinct contributions in this space. And so just another few sort of like ranking numbers for what it's worth, right? We are, just by virtue of our size, very highly ranked in terms of total R&D spend. CMU, as Theresa very clearly explained, very, very significant industry funding. That is a spectacular asset that we want to be able to better partner with and participate in, right? Then our significant funding on the NIH front, and CMU's significant funding in computer science is again, we have very complementary strengths. And we have, and I think this precision public health piece is an area where if we can lay out that vision of where we, what the big field looks like, where we have opportunity to like contribute, and then that can sort of start aligning people's vision of where those opportunities are, and start to bring together everybody to work on that. So. With that, I'm happy to take questions.
Thank you very much, Mike. And we are excited about this vision and the potential for the region to collaborate to make it a reality. And for the participants, please include your questions and related strengths and interests in the area of precision public health in the chat. I would also like just to hand it over to Kinsey Casey. Kinsey's work has been referred to already as the Associate Vice Chancellor for Economic Development and Health Sciences. She helps to lead the health sciences role in the growth of the region in life sciences and the biotech ecosystem, and has been coordinating the application on behalf of the region to become a tech hub. And Kinsey, I will hand it over to you to talk about that application that I believe was submitted last week, and the opportunities to incorporate patient safety into the hopeful phase 2. And Kinsey, you're muted.
Thank you. Sorry about that. Thank you so much, Robert, for the introduction. And let me share my screen. Can you all see that? All right. I know a lot of you have already seen this presentation, so I'll go through it really quickly, but wanted to also thank you for being part of such a impressive agenda today. Both Theresa and Mike were extremely helpful in the Tech Hubs application, and grateful for their commitment and insight and help in that project. I'll run through this really quickly so that we have a little bit of time to talk about how we can include patient safety into a hopeful phase 2 of the Tech Hubs. But just by way of background, this is part of the CHIPS and Science Act. And again, it is a place-based regional economic development strategy. And they're looking at leveraging existing strengths, not necessarily new technology. We just, as Robert said, submitted for phase 1. We actually submitted it a few days early, just because we were a little worried about the systems. So we submitted it on August 12th. There's currently $500 million appropriated and $10 billion authorized by the CHIPS. We are expecting that phase 2 to happen sometime this fall. So we'll find out if we made it through the designation phase and we're eligible to apply for the phase 2, which is the actual funding. The eligibility requirements, again, this is a consortium application. So we had a number of different organizations participating. We are in the most competitive EDA region, and our application is based on probably the most competitive scope of work. And there's a lot of evaluation criteria that they'll be looking at. So we tried to hit all of those in our 5-page application. Again, the key technology focus areas EDA was looking at, we chose AI, robotics, and biotechnology, obviously, given the strengths of our region. And I want to spend just a couple minutes to talk a little bit about our scope, which I know a lot of you heard last time, but this is where I'm hoping I can get some feedback from the group on how we might be able to incorporate patient safety into this. I have a lot of ideas, but I'm sure you do as well. We chose to play off of the strengths between Pitt and CMU. There's a little theme happening here today. And again, I sort of think it might have been EDA's evil genius to get Pitt and CMU really well coordinated. So to Mike Besich's point earlier, how do we better coordinate? The EDA really got us fired up and gave us a deadline where we had to really have some of these conversations specifically about, creating this biotechnology and biomanufacturing industry in Pittsburgh. And Theresa really led those conversations, and it was wonderful to get CMU faculty together with Pitt to think through how we can do this and partner in the future. Really what our scope was looking at, and the sort of secret sauce that we decided the region probably had to make a competitive case, given that we were applying in the most competitive EDA region, in the most competitive key technology focus areas, was to partner Pitt and CMU together and think about how we can disrupt the biomanufacturing processes. Currently, it's pretty old, kind of clunky technology that we're using. And I think on one of those calls, as someone said, there isn't enough square footage in the world to manufacture the therapies that are needed to treat the patient population. And so how do we really think through creating a new process for biomanufacturing and sort of reaching a broader scope of people, but also democratizing it, right? So you don't have to go to a hospital in Pittsburgh. You can be treated at a rural hospital, or even, it sounds sci-fi, but we're not that far away from it. How do you receive these treatments at home? So that's really what we were thinking about and where we based our application on. And I think that there are lots of opportunities within that to think through patient safety. And then, again, as I mentioned, it was a 5-page application, which doing anything in 5 pages with the number of players you have in a consortium was more complicated than I thought, thanks to Mike Holland for his advice and guidance on getting that done. It was due the 15th. We submitted on the 12th. Again, there's no funding in this phase. We ended up with 25, what we call consortium members, sort of those key players in the region. And we had 60 letters of support. And as I mentioned, phase 2, we're expecting in the fall of 23. So this fall, it may be pushed a little further out. We'll see when they announce that next round. NEDA will make at least 5 implementation awards. It's probably going to be somewhere between 5 and 10, and the amount will be somewhere between probably $50 and $75 million. So I went through that pretty quickly just because I had shared this presentation with this group not long ago, but certainly would love to take any questions and hear any thoughts about how we can sort of incorporate patient safety in a hopeful phase 2. We will find out again about that sometime this fall, but would love to think through with this group how we might incorporate that into our application.
Thank you, Kinsey. And, as Kinsey noted, we have a few minutes to hear from all of you if you have any questions or ideas around patient safety applications.
So I'll start. Thank you, Kinsey. When I think about patient safety, I think it's just such a wildly broad term. And I think if we're going to include it, we have to try to be specific. Do we mean in hospital? Do we mean in long-term care facilities? Do we mean at home? Do we mean in the community? Do we mean, medication errors, surgical errors, sort of public health initiatives? And so I think it's a question of trying to figure out how we can specifically try to focus on things to, again, I use the word leverage a lot, try to get leverage. I think there's a lot of opportunities out there, and people often talk about patient safety, but the more people we talk to, the more I understand how big a bucket that is. And people will talk about the crisis in nursing and bring that to patient safety. And so I think we have to be a bit creative, but also try to be specific.
Thank you. That's very helpful advice. If anyone else has anything else they could share, we will, if of course, if we're successful in a phase 2, we'll probably come back to this group as we're drafting that, because that will be a much more in-depth, probably longer than 5 pages. And we'll need a lot of assistance in making our way through that.
And as you know, I can see in the preparation for that, just to also let this group know, we, through the RAPS initiative, are also keeping a document that is compiling all of the biotech companies and innovators in the region. Now, many of you are on the line, about the work that they are doing as it relates to the intersections with patient safety. So I'm just noting that for everyone to say that if you would like to make sure that your group and work is featured on that list, please contact myself or Carolyn Burns or Lisa Boyd, who are all a part of the RAPS team.